Hi and welcome to Chirsports. I'm Dr Alfie. Today we're going to talk about a very important topic that's dear to my heart, and it's to do with neck pain. One of the most common problems we see in our patients that come in is they often come in with acute neck pain. It's the first time they've had it, they tell me, and then when you delve a little bit further into it, in actual fact it's not really just an acute recent problem. In actual fact the problem's probably been there for a long time. In actual fact it's chronic. So to actually have neck pain, it can actually come from simple things. The childbirth process itself can be traumatic, and that can put a lot of pressure on the child's neck. Even a forceps delivery can put an undue amount of pressure on a little neck. The other thing that happens as you grow up, a child will have various falls and spills from monkey bars and various swing sets, and just being kids. They say that an average child will fall anywhere between 1,000 to 2,000 times by the time they're two. It's a lot of falling. And so what happens is that those little incidences start to manifest. And one of the more common things we start to see later on in adults is we start to see people driving cars, and we think about motor vehicle accidents. And believe it or not, 11 kilometres an hour is enough to cause a whiplash injury to your neck. So even though it might seem like a little dingle at the time, that impact is enough to set a little seed in motion, and then you have a domino effect. That seed is planted. It might not be for a year, it may not be for 2 years, it may not be for 3 or 4 or 5 years, but then we see clients come in all the time suffering from neck pain. It's been there for a week, it's been there for a month. But little do they know is that seed has led to more chronic problems. We then x-ray their spine, and then what we start to see is there should be a normal C-shaped curve in your neck, but then what happens, it starts to straighten out, and as it straightens out, it puts pressure on various vertebrae and more in particular the nervous system. So now you're left with pain. But also this is the precursor to osteoarthritis or spinal degeneration, which can probably cause some of that creaking feeling that you may experience in your neck and the neck pain. That neck pain will affect the various nerves from your neck that can run straight down into your arms and hands. So it's not uncommon to feel pain or even pins and needles, carpal tunnel, tennis elbow in your arms. So it's very important that as soon as you have an accident, it might be trivial, a small motor vehicle accident that you thought was nothing to worry about, a child has a fall off the swings, it's very important to consider that they come into Chirosports, at least have a checkup, because if we can address the problem early, we're going to really prevent long-term problems. So thank you for listening.